I think I've broken my arm, but my GP was all booked out, and now I've been waiting in this hospital for hours. If only there was another option.
Well, the COVID-19 pandemic put significant strain on health services, particularly in Victoria with really long lockdown periods. We know that demand for emergency services continues to grow. In the last quarter of 21-22 financial year, 500,000 patients attended an emergency department in Victoria. We know that deferred care, particularly during the long Victorian lockdowns, combined with ongoing COVID waves, and burnout across the health system has really put pressure on the frontline general practice staff.
At the moment, Australia and Victoria is experiencing a really big shortage of GPs. So although GPs are working really hard, it's often hard for them to accommodate urgent things on the day. Like they may well be, I work in another general practice, so we may be fully booked, and one of my patients will ring saying they've cut themselves or they've got a break, and I'm already booked out for the day. And if I ask to see, if I do see them, then there'll be 5 other people waiting much longer for an appointment they've already waited several days for.
So something was needed to improve the equitable and timely access to urgent and emergency care in Victoria to make sure that patients had care at the right time at the right place. So to address this critical need, the Victorian PHNs partnered with the Department of Health in Victoria to commission 25 priority primary care centres. These GP-led services are designed to provide care for urgent but not life-threatening conditions and have availability for both walk-in and booked appointments. These clinics are seeing patients that are primarily described as category 4 or 5 patients by the ED triage system, and they're really designed to provide an alternative to ED to improve access and reduce waiting times in ED services. The services are established and need to have links with ancillary services such as radiology, pathology and pharmacy, with a particular focus of the availability of these services in the out-of-hours period. North Western Melbourne Primary Health Network was the lead PHN on this work and provided both statewide coordination and a lead in the data and analytics piece. The statewide role also included bringing together the priority primary care centres from around the state in a community of practice to enable peer-to-peer learning and help support those practices that are setting up these new services. The other really important aspect to setting up the priority primary care centres in Victoria was establishing local working groups.
At the local working group meetings, 4Health presents data on the kind of patients that we see, the impact on the community, our community engagement plans, and quality improvement and what the business is doing to make sure no patients are at risk.
So these are local working groups that the PHNs facilitate and bring together priority primary care centre staff, health service staff, Ambulance Victoria, in some cases the Victorian Virtual Emergency Department and other partners, and they really work on developing the pathways to and from ED and the priority primary care centre and other pathways as determined by patient need.
So we work very closely with the primary care centres. In some instances, we will assess you and determine that you actually do need a face-to-face consultation that needs to happen today or tomorrow, but not necessarily through an emergency department. Many of the PPCCs are well equipped to deal with your problem, and so we will direct you to your closest PPCC. We'll give them a call, let them know that you're arriving, and give you a time to arrive.
We occasionally do have people coming from the virtual emergency department, like they'll have picked up that the patient needs examination or needs a stitch or some steri-strips or something that obviously can't be done down a computer. We sometimes get people from the maternal child health nurse who might think the child needs a fever, has got a fever and needs us to look in their ear or something that they can't do over the telephone. And also that can be very reassuring for mothers to, say, look, this kid isn't quite as sick as they might have seemed, or they are really sick, off to hospital.
So far across the Victorian priority primary care centres, over 115,000 patients have been seen. Patients are provided with an experience survey, so they complete a survey when they attend the clinic and then invited to complete a survey to talk about their experience. Whilst the response rate of this survey is lower than we'd hoped, what we have seen is that 53% of patients that have attended a primary care centre have indicated that they would have gone to ED had the centre not been available. So we're really starting to see evidence that this is helping with ED diversion.
Mostly they say good things. Yeah, they're they're usually very happy to not have to wait in an emergency department for hours to have their stitches or an x-ray for a presumed fracture or a sporting injury. So they really love it. It's sort of filling a bit of a gap, and if they can't get in with their own GP for something urgent, we follow it up with we will send something to their GP to tell them where we're up to, and their GP can take it from there. So yeah, patients do seem to really like it, yeah.
Early engagement with local hospital networks is really key to the success of setting up a priority primary care centre. We found that engaging the local hospital network really early, even to the point of engaging some of the ED head clinicians in the evaluation process, was really key to ensuring they start to understand the value of and buy into the priority primary care centre, and really starts to establish that relationship between the local hospital network, ED and also the centre. Statewide coordination was really valuable, particularly in terms of being able to establish the statewide community of practice. So being able to bring together the clinicians and the operational staff from the priority primary care centres in a safe environment to allow them to share and learn from each other has been really key in helping them set up these priority primary care centres really quickly. Ensuring that there's robust data is really key so that we can really start to measure the impact of these services. So ensuring there's systems that are able to see and record the patients that are coming, when they're coming, what they're coming with, but equally as important and really valuable for ensuring quality improvement and performance in the clinics is actually the patient experience survey, and being able to understand how patients are finding their service at the priority primary care centre and what changes need to be put in place at the local level. Sound clinical governance is also really key. So the clinical reference group that was set up by the Department of Health to support this program really enabled the local working groups for each of the priority primary care centres to have an avenue to raise any clinical issues or risks with that clinical reference group and get that clinical guidance. This ensures that we continue to have quality improvement amongst the services to ensure safe, quality care is delivered.